This video is for informational purposes only and does not substitute professional medical advice, diagnosis, or treatment. Always consult your healthcare provider before making any health decisions.
Imagine if a simple protein could decide the course of your breast cancer treatment.
Well, that's exactly what happens with HER2-positive breast cancer. This particular type of cancer is fast-growing, and identifying it quickly is crucial. Did you know that 1 in 8 women will develop breast cancer in their lifetime? For 15% of them, it will be HER2-positive, which grows and spreads faster than other types. But don't worry, there's a specific test that can help your doctor figure out if your breast cancer falls into this category. Let's talk about the IHC test. Section 1. Understanding breast cancer and HER2 status. Breast cancer is incredibly common in people assigned female at birth, making up about 30% of all new cancer diagnoses each year. That's why knowing whether your breast cancer is HER2-positive is so important. But what does that even mean? HER2 stands for Human Epidermal Growth Factor Receptor 2, a protein that some cancer cells have in high amounts on their surface. If your breast cancer cells have more HER2 proteins, they grow faster. HER2-positive cancers tend to be more aggressive, but they can also be treated with drugs specifically targeting the HER2 protein. So, how do you know if your cancer is HER2-positive? That's where the IHC test comes in.
Section 2. What is the IHC test? The IHC test, or immunohistochemistry test, is a common way to check if your cancer cells have high levels of the HER2 protein. Think of it like a detective searching for clues. In this case, the clue is the HER2 protein, and the tools are antibodies designed to stick to it.
Doctors take a small piece of tissue from your breast tumor, either from a biopsy or surgery. They then add these HER2-specific antibodies to the tissue sample. If HER2 is present, a color change happens in the sample. The more HER2, the more color change. Simple, right?
The IHC test results are reported on a scale from 0 to 3+. 0 or 1+ means your cancer is HER2 negative. 2+ is equivocal, meaning the result isn't clear.
3+ means you're HER2 positive, which means your cancer is more aggressive but can be treated with targeted therapies.
Section 3. The role of the IHC test in staging cancer. But why is this test so important? The IHC test doesn't just tell you whether your cancer is HER2 positive, it also plays a role in understanding how advanced your cancer is. When doctors stage breast cancer, they look at how far it's spread and how aggressive it might be. Knowing your HER2 status is key here. Why? Because HER2-positive breast cancer requires specific treatment options. For instance, drugs like trastuzumab. You may have heard of Herceptin, are designed to block HER2, slowing the growth of cancer cells. Without knowing your HER2 status, your doctor can't recommend these life-saving treatments.
Section 4. The biopsy process. What to expect. So, how do doctors get the tissue they need for the IHC test? It all starts with a biopsy. This might sound scary, but let's break it down so you know what to expect. During a breast biopsy, your doctor uses imaging technology to guide a small, hollow needle to the affected area. Before this, you'll receive a local anesthetic, so you won't feel pain, just a bit of pressure. The whole process is done in a day, and once it's over, you can head straight home. After the biopsy, the sample is sent to a lab where pathologists, doctors who specialize in diagnosing diseases by looking at tissue, will analyze it using the IHC test. Section 5. What happens after the IHC test? Once the lab has finished the IHC test, your doctor will call with the results. This usually takes a few days, but the results are crucial for creating your treatment plan.
But here's something to be aware of. IHC tests aren't perfect. They focus on the HER2 protein, but sometimes, not all the cells in a tumor have the same amount of HER2. So, if the IHC result is equivocal, 2+, you might need further testing. That's where the FISH test comes in. Section 6. The FISH test, a backup for unclear results. If your IHC test result is unclear, your doctor may suggest a FISH test, which stands for fluorescence in situ hybridization. While the IHC test looks for the amount of HER2 protein on the cell's surface, The FISH test actually looks at the genes inside the cancer cells. This test is a bit more complicated and expensive, but it's more accurate. It involves attaching a fluorescent molecule to a piece of DNA that sticks to the HER2 gene. The pathologist can then see how many copies of the HER2 gene are present under a microscope. If there are extra copies, your cancer is HER2 positive. Although the FISH test takes longer to get results, it's often worth it to make sure you're getting the right diagnosis and treatment. Section 7. Accuracy matters. The risks of false results. Why all this focus on accuracy? Because getting the wrong HER2 status could mean the wrong treatment, and that can be a huge problem. If the IHC test gives a false negative result, meaning it says you're HER2 negative when you're actually HER2 positive, you won't get the targeted therapies that could help you. On the other hand, a false positive result could mean you're given unnecessary treatments that have side effects but won't help you.
This is why some people with an equivocal IHC result choose to have a FISH test as a follow-up. It provides more certainty, especially when it comes to critical treatment decisions. Section 8. Costs and coverage. You might be wondering, how much does all of this cost? According to reports from 2020, an IHC test for breast cancer costs between $127 and $129 per sample. That doesn't include the biopsy itself, but most health insurance plans cover these tests if they're medically necessary. If you're unsure about what your insurance will cover, it's always a good idea to contact your provider directly. A small conversation now could save you from unexpected bills later. Section 9. The bigger picture. Why IHC testing matters. At the end of the day, an IHC test could be the difference between getting the right treatment and missing out on life-saving therapies. By understanding whether your cancer is HER2 positive, you can work with your doctor to develop a targeted treatment plan that gives you the best chance of beating breast cancer. It's more than just a test. It's a crucial part of your journey, helping to steer the direction of your treatment. If you ever have questions about your results or want to know more about follow-up tests like the FISH test, don't hesitate to ask your doctor. Being informed can make all the difference. Conclusion. Breast cancer is challenging, but the more you know, the better prepared you are to fight it. HER2-positive cancers might be more aggressive, but they're also highly treatable when identified early through tests like IHC and FISH. Remember, asking the right questions and understanding your test results can shape your treatment path, and ultimately, your outcome. Stay informed, stay proactive, and know that you're not alone in this journey.